Warm greetings to all of you. In association with Swachhata Pakwada Celebrations 2022, let us learn a few things about health, hygiene, sanitation, its importance in our day to day life, and also the problems associated with lack of hygiene. What do you mean by hygiene? Hygiene is defined as the science and practice of maintaining good health. It requires two aspects, taking care of your own body, which is called personal hygiene, as well as taking proper care of one's surroundings, which is otherwise called environmental hygiene. In the last webinar, we learned in detail about personal hygiene. So, in this webinar, we learned in detail about environmental hygiene. What happens when there is lack of environmental hygiene? Lack of environmental hygiene becomes a community problem. Why? Because it can lead to outbreak of certain diseases like diarrheal diseases, mosquito-borne diseases, etc. in the community, in which a large number of people can get affected at the same time. Let us learn about one by one in detail. First, we'll see what is diarrheal diseases. What do you understand by diarrhea? Diarrhea is defined as the passage of unusually loose or watery stools at least 3 times in a day, that is, in a 24-hour period. Whereas, frequent passage of formed stools is not considered as diarrhea. Similarly, passage of loose, pasty stools in babies who are breastfed is also not considered as diarrhea. How is this diarrhea caused? Diarrhea is usually caused by a bacterium, a virus, or a parasitic organism. How does this infection spread? This infection is spread by contaminated food, contaminated drinking water, or from person to person also as a result of improper hygiene. Why we are concerned about diarrhea? Because diarrheal disease is the leading cause of mortality as well as morbidity in very small children. Statistics show that diarrhea kills approximately 1.5 million children globally every year. In addition to this, diarrhea is the leading cause of malnutrition in children under 5 years of age. Another reason why we are concerned about diarrhea is that it can cause loss of fluid as well as electrolytes along with stools, resulting in acid-base imbalance in the body, which ultimately leads to decreased BP, patient can go in for shock. All these can be deleterious to the life of the person. That is why we are concerned about diarrhea. Now that we know what is diarrhea, let us learn about the types of diarrheal diseases. Basically, diarrheal diseases are classified into 4. First one is acute watery diarrhea. As the name indicates, acute watery diarrhea causes too much of loss of water from the body. Most common causative organism for acute watery diarrhea is rotavirus. In children, almost 70% of diarrhea is caused by the rotavirus. That is why we give rotavirus vaccine to infants to prevent this type of diarrhea. Another example of acute watery diarrhea is cholera, which causes rice water stools. The second type of diarrheal disease is bloody diarrhea. This type of diarrhea is otherwise called dysentery. In this type of diarrhea, in addition to loss of stools, blood and mucus is also found along with stools. Why? Because there is damage to intestinal epithelium also. The third type of diarrhea is called persistent diarrhea, in which loose stools last for more than 14 days or even longer. It can either be infective or non-infective also in nature. The fourth type of diarrhea is associated with severe malnutrition. It is seen in conditions like kwashiorkor or marasmus, which are basically protein energy malnutrition conditions. Why we are concerned about this type of diarrhea is that the main danger associated with this type of diarrhea is severe systemic infection. The child can go in for heart failure. This can result in severe vitamin and mineral deficiency. Okay. Now we have understood the types of diarrhea. We'll see how this can be managed. Management of diarrhea. Most of the cases of diarrhea can be managed at home itself. Over 90% of death resulting from diarrhea in under 5 age group can be prevented by continuing breastfeeding or other modes of feeding throughout the attack of diarrhea. This is mainly done because this prevents malnutrition. Another important aspect in the management of diarrhea is to make sure mothers know when to take the child to a health facility when the child is seriously sick. Mothers or caregivers should look out for signs of dehydration like sunken eyes, decreased tears, decreased urine output, decreased activity in child. In any of these conditions, child has to be taken to the hospital for further treatment. Usually, general laboratory tests are not done in a patient with diarrhea. Most important aspect in the management of diarrhea is rehydration. ORS or oral rehydration salt can be given to correct the fluid and electrolyte balance associated with diarrhea. ORS should be given after each episode of passage of stool. WHO formula ORS is available commercially in packets which can be reconstituted with drinking water at home itself. Alternatively, fluid with similar constitution like that of the ORS can be made at home itself by mixing 6 teaspoons of sugar with 0.5 teaspoons of salt in 1 liter of boiled and cooled water. ORS should be given after each episode of passage of stool. WHO formulated ORS is available commercially in packets which can be reconstituted with drinking water at home. Alternatively, fluid with similar constitution can be made at home by mixing 6 teaspoons of sugar with 0.5 teaspoons of salt in 1 liter of boiled and cooled water. If this is also not available, it is easier to give yogurt drinks, salted kanji water, tender coconut water, etc. after passage of each stool. To prevent further episodes of diarrhea, zinc supplementation helps a lot. Zinc is recommended for all children with diarrhea for a period of 10 days. Antibiotics are not routinely indicated in diarrhea, but if it is bloody diarrhea, antibiotics has to be given and the child has to be taken to the hospital. Certain probiotics like lactobacillus are also shown to decrease duration of diarrhea.
Now let's talk about mosquito-borne diseases. When a mosquito feeds on blood, it also swallows any virus or parasite living in the blood. This virus and parasite can be transferred to the next person when a mosquito bites through its saliva. Any disease that is spread in this way from mosquito to human is known as mosquito-borne diseases. Common types of mosquito-borne diseases include malaria, dengue, chikungunya, yellow fever and Zika. Coming to malaria, malaria is caused by malaria parasite and it is transmitted by Anopheline mosquito. Symptoms include fever, headache, muscle pain, vomiting, diarrhea and abdominal pain. Malaria during pregnancy can have adverse effects on both mother and fetus. Effective medicines are available against malaria, but early diagnosis and prompt treatment are crucial. Coming to Zika, transmitted is by Aedes aegypti mosquito. In many cases, there are no symptoms, but it can present in a similar way to dengue fever. Symptoms include rashes over the body. Women who are infected by Zika virus during pregnancy can bear children with serious health conditions including microcephaly and Guillain-Barré syndrome. Treatment is symptomatic relief and prevention of dehydration. Coming to dengue fever, it is also transmitted by Aedes aegypti mosquito and the symptoms typically begin 3 to 14 days after infection. It includes high-grade fever, headache, vomiting, muscle and joint pains and a characteristic skin rash. Dengue fever can develop into a more severe form which is known as dengue hemorrhagic fever. Adequate hydration should be ensured for dengue patients. Coming to chikungunya, it is transmitted by Aedes aegypti mosquitoes. Chikungunya causes severe fever and debilitating joint pain and shares some clinical signs with Zika and dengue, which sometimes lead to a misdiagnosis in areas where there is disease prevalence. Symptoms usually improve within a week, however, sometimes the joint pain may persist for months or even years. Coming to the prevention of mosquito-borne diseases. The most effective way to prevent mosquito-borne disease is to keep the environment clean, remove stagnant water by changing the water vases at least once in a week, avoid using saucers underneath flower pots, cover water containers tightly, ensure air conditioner drip trays are free from stagnant water, pull all used cans and bottles into a covered dustbin, and Prevent mosquito breeding by source reduction. Environment-friendly insecticides such as larvicidal oil can be used. Keeping fishes in ponds that eat mosquito larvae is another method. Observing dry day once in a week is also advisable. Prevention of mosquito bites by wearing loose, light-colored, long-sleeved tops and trousers are also advisable. Use insect repellents on exposed parts of the body and use mosquito screens and bed nets. And these all are all about mosquito-borne diseases.
Now that we have learned in detail about diarrheal disease and mosquito-borne diseases, I hope you all have understood the importance of maintaining environmental sanitation. As the saying goes, cleanliness is next to godliness. Thank you.